the house today. We are also recording this meeting, so you might see a pop-up on the screen in addition to the pop-up for the poll. I'm going to go over some quick housekeeping. Please remain on mute throughout the session. As you can see, this is an interactive type of webinar where we have all of our screens up there. We also want to make sure that you can use the chat throughout the conversation to interact with each other. If you pop any questions in the chat, we will be collecting those, and we have a Q&A section towards the end of the talk where we will be doing that Q&A with those questions. And I will stop right there. I'm going to end the poll right now. And I will pass it over to our wonderful host, Alli and Marna, which you can see on the screen right now. Take it away.
Good morning, and well, it's morning over here in San Francisco, so good morning to you. Oh, it's actually noon. Good afternoon, everyone. It's noon. I want to welcome you to our very first ever community share out SisterWeb Shines, our community impact report. And I am Marna Armstead. I am one of the co-founders, and I am also executive director with SisterWeb. And I'll pass it briefly to Alli to introduce herself.
Greetings, everybody. We're really excited to be here. My name is Alli Cuentos. I'm one of the co-founders of SisterWeb along with Marna, and currently serve as the Director of Evaluations, aka the Data Queen.
Thank you, Alli. And so we're just going to jump right into it. Most of you are here. I recognize a lot of you. They're familiar with SisterWeb and our work. But I want to share with you a little bit about our birth story and kind of how we came to be. And I'll share it mostly from my perspective because of the unique way that I came into this work. So I am self-identified as a Black woman. In 2000, I was faced with an unplanned pregnancy. And I went to my OB to connect with her around my first prenatal appointments. And what I received there, I felt was discriminatory service. And I think that my provider did not listen to me. And I was very disheartened because at the time that I thought I could trust my provider, she was very adamant about not listening to me and even going against my wishes. And on top of that, the care that I received wasn't fair. And I didn't realize it at the time. I thought it was just me. And because of my circumstances, my own feelings about it, I thought this is what happens when you're in this situation and you kind of deserve it. And what I realized was that I was not alone. But I did have a high-risk pregnancy. I had gestational diabetes. I had preeclampsia. I was hospitalized. My daughter, when she was born, although I enlisted my mother and my sister as my doulas, she was in NICU. But it's through the education that I decided that I would take upon myself and read books and empower myself to learn about my body. And I decided that I could birth my baby the way that I wanted to, and I did. And in the moments of me actually pushing out my daughter, who is going to be 23 this year, I thought that I could help some women. I wanted to do this same thing. I didn't know what it was. I had no idea what a doula was. I just realized that I wanted to help other women support them through their pregnancy journey. So fast forward, I start helping family members and friends that I know, and I find out about doula work. And I start to learn that the things that I went through, I was not alone. And I was in a sad, almost majority that a lot of Black women experience discrimination in their healthcare settings. They have these different outcomes. They have NICU births. And I became a part of this bittersweet group of folks that experience inequities. And so it went from me wanting to help folks, just support them have this experience, to now understanding that there were health implications that we must pay attention to. And through that training, I decided I'd become a doula. And as I was working to become a doula, I could not get paid. As a Black woman helping my Black folks in my community in San Francisco, I couldn't get paid. And I was introduced to Alli, who's sitting virtually beside me, and also our other co-founder. We do have had a third co-founder. She's not with us anymore, but we did have a third co-founder. And my conversation with Alli was that she was also a birth worker working in San Francisco and didn't have any problem getting paid, getting clients. There were no issues. She was not having the issues that I was experiencing as a Black woman serving my community. And so through our conversations, we realized that we wanted to provide quality doula care to Black and Brown folks with Black and Brown doulas in San Francisco. And that basically birthed SisterWeb. So what you're now experiencing, even through this community impact report, is our shared vision. And so we started at Community Well. We were awarded seed funding December 2018 and opened our doors March of 2019. So yes, we pulled off an amazing feat in about 90 days. And we were charged with starting a program from nothing to open doors and accepting clients. And it was crazy. We were not an existing organization. We weren't an extension of another program. We weren't part of a hospital or medical system or public health system. We started from nothing. We had no infrastructure. We were meeting at cafes and at houses. And then we were welcomed into Community Well, which is where we like to say is our start. So there's an organization in San Francisco called Community Well that we have that have helped incubate us, and we've partnered with throughout the years and continue to provide services. And so since we've been born, we went through that quick launch in 90 days. In 2020, we were in COVID shelter in place. We grew through a pandemic. We went through change and transformation. And then we are now in a place this year where we're stabilizing and operationalizing our work. So we've helped birth hundreds of babies and supported thousands of people. And to be honest, we did this in a global crisis. And it's been good, but it's been really hard. We've done many things like the pop-ups and classes. We've given away diapers and wipes and other things. And we've ensured that our families had what they needed to birth their babies. And we've also had many challenges. We've had staff transitions. We're meeting organizational needs and growing and implementing our strategic plan, that moves SisterWeb forward. And so I'm going to share a few slides. So I'm going to ask Sophia to share some slides so I could give you some data points about our 2022 highlights, successes. So let's go. Oops. There we go. A little bit of technical things going through here. So in our 2022, we've trained community members as new doulas. We've hired community members as staff doulas. We are starting a pilot apprentice program. I'll tell you a little bit more about that, but 2 out of the 3 apprentices that we are working with are ready for employment and interested in employment with SisterWeb. We've had 13 birth core competency trainings, and those are our birth-related trainings. And what I really want you to pay attention to as you're looking at this is that the average amount that our SisterWeb doulas feel that we're helping them achieve their goals, that they're feeling their birth work skills are improving, and that they feel that SisterWeb staff, that they feel that they're seen and included in their work as a broader movement as change in the city. So these are great outcomes from us. And you can move to the next slide, our client successes. So you can see that 100% of our clients, that's all of our clients, have felt that SisterWeb is helping them feel connected to their babies. 100% of the clients would like to have a doula again. 85% of our clients would like to become doulas. 95% of our clients initiated breastfeeding at birth, and 75% of our clients are breastfeeding at 6 weeks postpartum. And I just like to point that out because according to the city of San Francisco, where we are exclusively working, their 6-week breastfeeding rate is about 59%. So just working with our staff, we're able to increase those breastfeeding rates. And so we also see our prenatal and postpartum
Did Marna freeze?
I'm having a little bit of an error. Okay, there we go. Next slide, please. Next slide. Yes, highlights. Our doulas are spending 17 hours with our clients in labor and birth. That's the average time. So you're aware. 100% of our clients feel that they felt understood by their doula. 100% of the clients say that SisterWeb helped them feel more confident. 100% of our clients report they walked away from their experience feeling proud and dignified. So, and we've also, we have other data, and we've also published and co-authored a number of academic articles documenting our work. Some of you all are here today because of that. And do you have one more slide, Sophia, for our demographics? Just so people are aware of the folks that we support. Our top one for those in San Francisco, these are 29% of our clients are in Bayview's Hunters Point district, and 16% are within district, I think this is district 11. So that is the majority of our clients, and that is the majority of folks in those districts. They are Black and brown folks. So those are Black and our Latinx community. And we serve approximately 20 to 25% of all Black births in San Francisco. 68% of our clients have public insurance. I'm skipping and, just going through them. 18% of our clients are designated code purple. Code purple for us are high risk or high need. So that could be medical high risk. That could be, social determinant high risk. They could be housing insecure. There could be a number of other things that are not tied directly to their health that impact whether or not they have lots of needs. And 61% of our clients receive public benefits. So Sophia, you could stop sharing those slides, and I just throw those data points up there so you could see a little bit of the work that we do, and also to acknowledge that we've had lots of success, but we've had lots of challenges. And so I want to go over a few of our challenges so that you understand what we're dealing with. One of our first challenges is childcare, and that our interested community members, they're signing up to become doulas. They want to be apprentices. They want to train as doulas. Some of the people signing up were former clients, and there is a need for adequate and affordable childcare. And so we've seen the need for regular childcare. We've seen the need for on-call childcare so that doulas can attend births as clients need. And so we've yet to figure out a solution, but we're engaging in creative discussions to see what we can do to help remove barriers. Another need that we have are transportation needs. Our doulas work and live in many places and use public transportation. And this massive challenge is when doulas are on call, and they could be called to attend birth at any time, day or night, and there are no public transit services. So one of the ways that we're trying to solve this is we have a grant that allows us to work with a rideshare company, Uber, and we provide rides for our doulas to and from births. Eventually, we're extending to all our client appointments, all of our SisterWeb meetings, and then activities and our clients. So yes, we are working to provide Uber rides to our clients who need them. And part of this is discovering the cost of transportation overall, and if providing rides to staff is a cost that we can sustain, because we are already seeing immediately that it is removing a barrier. So our third one are housing needs. Our current and potential doulas have expressed a need for affordable housing. We understand that this isn't SisterWeb's issue alone, but it's a societal issue, and affordable housing along with childcare can impact a person's ability to acquire and maintain employment. So we're doing our best to connect our community to the best available resources. Another challenge is our mental health concerns of our clients, and that our doulas are repeatedly expressing concern that they need more help in training and resources to manage clients with mental health needs. So we're working with several community partners to deepen our understanding and fortify our tool belt to provide training tools and resource pathways for our staff and our clients. And last but not least is our actual staffing needs. Our slots for matching clients are routinely full. We maintain a wait list of clients. and we're ready to scale our doulas. We currently have 8 full-time doulas. We are ready to scale to at least 15. For example, there's even a demand now. We've had over 50 people apply to our new doula training that's happening right now. And all of those participants have stated that they would love to apply to a position at SisterWeb. And then we need to hire more mentors to support those doulas with the client needs. And that also talks about our infrastructure and our sustainability. So we know that our doulas are coming from the systemically underserved and under-resourced communities, and they're often experiencing the same traumas. They have personal, emotional, and societal and economic. So our doulas and our clients can actively experience exactly the same things at the same time. The difference is our doulas are working with us, and they're being called to step into a place while they're also experiencing their own difficulties. And so we need to have support folks in place. That means making sure we have our workforce development manager, and that we even have a training manager, because if we go back to the doula apprentice program, we're finding it is a key pathway to connecting new community members to the work, giving them the experiential knowledge and preparing them for work as a doula. And that requires brand new staff. And so why do we talk about our organization's need beyond the direct service work? Again, we are acknowledging that we're working in crisis and that it affects our well-being. And we also acknowledge that our birth worker lifestyle can be demanding and at times intrusive. And so we acknowledge that if we can't acknowledge the challenges and be proactive in discovering solutions, we won't be sustainable. And all of the challenges I mentioned impact our ability to scale and increase our efforts. And everything that I've mentioned does not have a funding source directly tied to it. And Alli will talk a little bit more about that, but I just want to say, I wish I could wave my magic wand and erase, all of our problems, solve our problems, but we can't. We're on that road, and the truth is that we're not the only doula organization experiencing this issue. And that's why even if you've seen our webinar or seen our policy brief for our doulas getting paid, that we partner with Health Connect One and a number of other doula organizations across the country, you'll see that it's not surprising. These challenges are part of organizational growth. And we personally, SisterWeb, has seen a lot of growth in the past few years alone. And this is one of the significant reasons we decided to create this opportunity to share our successes and our challenges and our highlights. And we feel that it's essential. And in a way, we feel it's a more holistic opportunity that accurately describes the experiences of our staff and clients. So we're taking this opportunity to share with you, because a lot of times we work with funders and different things, and Alli will talk more about that, and we don't get to tell our story in the holistic way that we would like to, and this is our opportunity to do that. And so in the end, our thoughtful and realistic, successful solutions, they don't happen overnight. And we appreciate our community and our stakeholders as we continue to grow. So I'm going to pass it back to Alli to talk and take a deeper dive into our data share. So take it away, Alli.
I caught it. Thank you, Marna. I just want to take a deep breath. And every time I get to hear Marna's story and share space in this way, want to acknowledge the vulnerability and the strength of showing up and speaking truth, because I believe that it's one way that as doulas, we can practice it ourselves and keep encouraging our clients to also keep showing up, using their voices, and believing in big systems change. So I give thanks for being here today. I'm joining from the Excelsior neighborhood of San Francisco on what is unceded Ramaytush Ohlone lands. We want to acknowledge and give thanks to the Ohlone peoples, past, present, and future. And we strive to be good neighbors and good co-stewards of this place. I also want to just step in with a couple quick thank yous. As Marna said, a lot of things that we're doing in SisterWeb, we still keep saying, and this is the first time we did that. And this is the first time we did that. So it is our first public Zoom call, webinar, community call to share our successes and highlights. I really want to give thanks to Sophia, who you all heard speak at the beginning of this, our brand new communications coordinator. And without her support, we never would have pulled this off. So big shout out. I also just want to acknowledge all of the people who are joining this call. We have SisterWeb staff. Whoop, whoop, whoop. We see you. We have community partners and funders who rode with us since the beginning. We see you and appreciate you. And then we're also seeing some folks joining from other geographic places in the country, other birth workers, other community doulas. And we just cannot say enough that we believe we are stronger together. So after this call, if you want to reach out, Marna and I, our inboxes are always open. I also can't not say thanks, Mom and Dad. You're joining from downstairs, and I appreciate you. So in this moment, you know, Marna gave you all a snapshot of some of our data from the very, very beginning of SisterWeb. Marna and I were in sync, in agreement that in order to really put down roots and build a program that was going to be successful, we needed to not only be looking at what were the strengths in the community and what opportunities, but what were the threats, right? And Marna spoke about a lot of those unjust, unfair arrows that are thrown at community historically, persistently. The prevalence of racism within healthcare institutions, housing policies, and also looking at the history of smaller grassroots organizations trying to get off the ground. We knew that there were going to be threats in our path. And so I think one of the things that we both, our past experiences at other nonprofits and other community programs, was so many times folks know the impact of the work, and we can say, we know we're doing good in the community. We see it in the faces of our clients. We see it in tears of joy of folks going through birth and feeling supported, but we don't have it on paper, right? And how many times I'm just like, pause if you're on this call and this has ever happened to you in your own professional or personal journey, is where it's like, I know I did the work, but I can't actually show it in a documented way. So one of the things that we started from the beginning was we knew we needed a framework for how to help ourselves document what we were doing, show the impact that we were having on the community, and not only that, but hold ourselves accountable, right? I think that that sense of, I want to say, being in right action, right? Like the nonprofit world, unfortunately, sometimes perpetuates some of those same threats of the community, of folks taking money, saying they're doing one thing, and then are we actually doing what we said we were going to do? So I want to acknowledge this language that came from a wonderful training we all took at the Management Center, when they talked about nonprofits and community orgs being able to name, what is it that we are actually striving for? What are our goals? And they described it as a perfect cake. So this is something we talk a lot about, and being able to say, if we were doing exactly what we set out to do, right? If we were really walking towards our vision, uplifting Black and Brown communities, autonomy and journeys to have a joyful and respected and dignified birthing and early parenting experience, how would we know if we were on the right track? And so we're going to be sharing with you all a at a glance view of our strategic plan. And that really is the roadmap that we're so grateful we had a funder who recognized, hey, that quick start Marna was talking about, it didn't give us a chance to lay down the blueprint of all the nitty gritty. Like, what does it really take to run an organization that is sustainable, that doesn't exploit our staff in ways that are even unconscious, and that really is able to maintain its successes and grow over time. So our strategic plan, which was put together by some amazing consultants, Ramey and Associates, now we have this 5-year blueprint of how can we stay focused. And when I say focus, sometimes that means we got to stop doing some stuff, right? And we have to hone in on what are our priorities and really stay on track with achieving our goals. So my job in the department that I run, along with some really amazing Masters in Public Health students, is continuously evaluating our work using the framework results-based accountability. We use 2 different software products by the company Clear Impact. One is a software product called Scorecard that some of you from public health systems might be familiar with. And the other is their case management software called Compile. So a lot of the data points that Marna showed, for each one of those data points, we could say, let's pause. Let's do a TO. I have 4 kids, so we do this a lot at home. TO, time out. What is the perfect cake here, right? For each one of those data points, where are we striving to go? And then what are the deeper stories behind that data point, right? Marna talked about some of the data points related to our staff satisfaction. We ask a lot of SisterWeb staff. They complete monthly surveys that are mandatory. Some of y'all might go, oh my gosh, I get surveys from my work and I never fill them out. Well, in SisterWeb, we actually said it's not an option, because that report card to know how are we doing, we need the data coming in, right? So it is a partnership with our staff, right? Who is SisterWeb? It is all of us. So as a staff person, I have to fill out my monthly survey every month, and it gives our leadership really a temperature check. How are we doing? Are we meeting our staff needs? What are those key issues that Marna raised? Needs of our staff related to childcare or housing. How are we knowing what those needs are? And then from our clients, any of you who have run direct service with new families know that it's really hard to get parents with newborns to fill out anything. And I remember being postpartum, being like, I don't even know what day it is. I'm definitely not looking at my email. So one of the things that we've been doing is trying different ways to engage our clients. In the past year, we were able, with a lot of good work by some of the Masters in Public Health interns, to get our return rate of client satisfaction surveys up to 75%. So those numbers of doula clients reporting how SisterWeb doulas impacted their experience in a positive way, that reflects a really large chunk of our clients, which means the data is more accurate. It lets us know how we're doing. We also have started using techniques that are more about the stories, less about the numbers. So we were able to run a photo voice project last year with our doulas, allowing them to submit images from their lives. Like, what really does community doula life look like? What are those images where they get a chance to say, snapshot, this is the real talk. This is what doula life looks like. And then quotes about their own experiences. Please check out our Instagram page that Sophia has been managing, because you can find all of those beautiful images and quotes on there. We are now completing the same project, but with our clients. So we got 9 of our clients who've already had their babies to also submit images and quotes about their experience. I do want to pause and say, and I know Marna was kind of sending me little folded up paper airplanes to talk specifically about our relationship with our funders, and so much of the work that the true cost of running a doula program, that oftentimes those line items that never seem to have the right grant opportunity or the right funder that will cover it. Right? A lot of times, both public and private funders, they want to fund the birth, right? The birth, it's like that slice of work. How many births did we attend? How many clients did we attend? And the more that we collect data, and this is a large part of why we're participating in a national movement with other community doula programs, is really trying to pull open the curtains on all the work that goes in behind the scenes of the birth. On average, our doula clients, for every hour that they spend with a client in a scheduled prenatal or postpartum visit, they're spending an additional hour texting, calling, dropping off diapers, right? Those workforce data points are so key because a lot of times they're not taken into consideration when we look at funding streams, and definitely not when we're looking at the new Medicaid reimbursement rates that are coming out. We also want to look at the true story of some of the unquantifiable parts of birth work, that emotional load. And, you know, I'm sending big hearts to my mom and dad because I am very fortunate. I have family support, even working as the behind the scenes data person at SisterWeb. I'm still attending births on the side as a private doula. And my last birth took me away for 2 consecutive nights from my 4 kids and my family. And all of that labor that goes into it, the SisterWeb doulas have been expressing and letting us and their mentors and their supervisors know some of that cumulative exhaustion, some of the emotional load of what they're carrying alongside of their clients. It is a lot. So I will say, SisterWeb, we are committed to not only showing in these, I'll say like the more flashy numbers, what the impact is in the community, but also really finding ways to give the mic to our doulas, to what they're saying, to our clients about some of the inequities they're experiencing in healthcare, that we can go beyond the numbers and look at what does it take to run a doula program that is from the community for the community, and what are some of those bigger root cause issues that we have to be addressing in our work. If Sophia, do you mind showing the 2-page doula report? This is a report that was put together by one of our Masters in Public Health students, Quinn Nguyen. So we want to give a big shout out to her, helping us specifically with our data visualization. And we really, you know, hope that everybody gets to look over this report on your own time. You can see some of the numbers that Marna was talking about. Up here, the 167 prenatal appointments, 154 postpartum appointments, 98 sessions between their doulas and their mentors. And I want to pause and give huge thanks to the SisterWeb mentors. These are expert birth workers, they are midwives, and they are on call 24/7 to our doulas. They are often that first line of support for our doulas, seeking questions about birth work, emotional support. And this is something that Marna, as executive director, has fought for, that we need these positions to be stabled and salaried along with our doulas for the well-being of our staff. We also, you know, want to just focus on this 9.5 out of 10 doulas reporting that they feel that their organization attends to their emotional and physical well-being. I will say that ethically, like, we really believe we have to be looking at this number frequently, right? It's not a one and done. This is not an annual number. This is something we check in on monthly, because if things are not well with our staff and our doulas, and SisterWeb needs to be addressing concerns that are timely, this is a data point that we look at very often. Can you scroll to the next page? So here we see some of those data points that Marna was describing, feeling connected to their SisterWeb clients, feeling connected to their body, connected to their baby. And then scrolling down a little bit more, this part around utilizing resources. This was another need that emerged from our doulas saying, wow, our clients have a lot of needs, and us working as doulas, we don't always have the most up-to-date information on community resources that are available to our clients, whether they be about where to get free diapers out in the community, right? Or which housing clinics are open to new clients. So we were able to onboard the amazing Amy Mancha, who I believe is on the call. Shout out to Amy, as our new community resource coordinator. And this also works in tandem with the doulas, providing information and resources to the doulas to share out, but also connecting directly with the clients when needed. And, you know, I think if you want to zoom out again, or yeah, this last bullet point, the 99% of our clients said it was important to them that their doula be of a similar cultural background to them and their family. And with this, you can stop sharing. And I would like to name that myself as a white-bodied identified birth worker, even though I grew up bilingual and able to speak Spanish, and I've worked a lot with the Latinx community in San Francisco, it was always clear to me that language ability is only one small part of being the best person situated to walk side by side with a client. And so for us to maintain this value as an organization of supporting and uplifting birth workers who come really from the same communities as our clients, this commitment to culturally congruent doula care, for us, we take it really seriously. And there is a lot of, going back to the threats, a lot of arrows coming at us of why it's difficult to sustain this workforce. I want to end just by, again, inviting everybody to share with us not only your questions, concerns, thoughts, but if you are running a program in another part of the country, if you have ideas, even locally, about how to improve our programs. For those who don't know, our SisterWeb logo is a West African Adinka that means lifelong learning. And we chose that meaning because as birth workers, every birth is a new opportunity to learn and walk with a unique family on their journey and experience. But it's also about being open to new ideas and new resources that we're never done. That perfect cake, it keeps changing. So please reach out, don't be strangers. And I'm going to pass it on back to Marna.
Thank you, Alli. You'll be a witness to our love fest. I'm so grateful to have her as a partner and co-founder. This could not be possible without her, with us together, and without all of our team participating in all of the surveys, being invested fully and completely into the work and committed to our community. So I just want to thank our SisterWeb team for just being an amazing A1 team. And I think that, Alli, you've covered everything so amazingly that we are ready for questions, I feel. So I don't know if there are any questions or comments. As Alli was saying, we are open to hear and share.
We didn't have any questions in the chat.
Thank
Awesome.
you. Thank you, Patty, for keeping a close eye on the chat for questions. Thank you, Marna and Alli, for this wonderful presentation. I want to give some notes about the Q&A section. So we definitely want to give people the opportunity to ask questions live. And you can do this by raising your hand. And to raise your hand, you just click on the smiley face that's at the bottom right of the menu bar on the screen where it says reactions. So you click that and you'll see the raise hand button. And then whenever we see you, we will unmute you and give you the opportunity to ask your question. Of course, you are more than welcome to just drop your question in the chat.
And Sophia, if you could also share the strategic plan at a glance in the chat.
Yes, I shared that. I also shared the 2-pager impact report. I'll send those links again in case some new folks have joined. All right, Samantha.
Hello.
Samantha, we can't hear you.
Am I still on? Okay.
Yes, we can see you and hear you now.
Okay, it kicked me out. So I'll talk quickly. It's something that our doulas struggle with. I'm from Reach Up. We're a community doula program in Tampa Bay. Our doulas, we do surveys frequently as well. We ask our doulas to complete surveys that are sort of like case reports kind of thing. And our doulas, I would love to learn more about your platform for receiving photos from your doulas as well as from clients. Like, is there a certain software that you use for that, or ask them to, I guess, just to protect their like patient like confidentiality? Thank you.
Yeah, that's a great question. I can answer that one. So I think I'm going to split it into 2 parts. One is about our actual client forms. So every time a doula attends a meeting with a client, or the doula coordinators that I also want to shout out, Bria and Vanessa, our doula coordinators for our Kindred Birth Companions and Semilla Sagrada programs, they meet with clients for an initial intake. And then once they're matched with their doulas, our doulas fill out forms on the platform I mentioned earlier, which is called Compile. It is a HIPAA compliant platform. And so we do really deeply care about confidentiality. Our clients sign consent forms when they're onboarded. And in terms of sharing photos, so far within SisterWeb, we actually have collected very few photos from our clients, only in specific opportunities like the Photo Voice Project. We recently had a storytelling circle with clients, and only the folks who wanted to participate came. They signed media release forms and consent forms for that project. So we have not made it like a blanket part of our program to share photos from births or from our direct clients. I see there is another hand up.
Darlene, would you like to ask your question?
Hi. Oh, wait, let me lower my hand here. Well, first of all, thank you for everything that you guys are doing. It's like, wow. And I mean, it's like, that's what we want to do when we grow up. I am the founder and executive director for Healing Hands Community Doula Project in Austin, Texas. And the question I had is there, I don't know if I would just email you guys a way to kind of keep in contact and share ideas, because some of the things that you're doing, like we have a child, not we personally, but there is a childcare program going on in Central Texas, so that I could connect you with people who and how they were doing that. But then also to say, wait, how did you guys do this? And then you might say, well, how did you guys do that? Is there, I don't know, is there any sort of networking going on in that respect?
Marna, I'm like, I could answer one part and then I'm going to pass it on to Marna. You know, first off, Darlene, thank you for joining. We are so excited. Like, you know, Marna and I always joke, if we won the lottery, we would want to get all of our doulas together to travel around and visit all the programs going on. I think that one of the ways that we have been trying to build community and a sense of peer learning with other programs is through the efforts that Marna was talking about jointly co-led with Health Connect One in Chicago, we've launched a project called the Doula Data Consortium. So far, we are 7 different doula programs nationally. Some of them I see repped on the call today: Accompany Doula Care, Ancient Song Doula Services. We also have Birth Matters in South Carolina, Tulsa Birth Equity Initiative, and I feel like I'm missing some folks, trying to rattle them off right now. But one of the sparks to bring us all together was that need to create the policy brief around recommendations for fair reimbursement rates. While we were working on the brief, we were like, hey, we have a lot to talk about, and specifically resource sharing around data collection and how we're all using documentation and data. So if you're interested in joining with that effort, you can email me. I'll put my email address in the chat. And then I'll also say that Marna and I have had plenty of just informational calls with other doula programs, looking for some of that quick connect, like, hey, I have a burning question. Let me ask somebody else who's already doing it. So those are 2 things. I'll pass it on to Marna if she has an additional answer.
I think, Alli, you pretty much covered it. Yeah, I think the first connection, organizationally, if you want to stay connected to us by through the organization, I think the Doula Data Consortium project is one of the best ways to do that. And then, of course, even just signing up for our newsletters and being a part of our mailing list, we'll send you information. And then, as Alli said, if you see something pressing, I think Sophia put, yeah, we're putting our emails and everything in the chat, so you can reach out to us directly. We try to, accommodate as many people as we can. If there are pressing questions, or if you, especially as a executive director, if you have some ED level questions, some high level questions that you're just burning to get some information or insight on, feel free to reach out to me. And we're also looking at other ways to create like collaboratory learning or convening. I feel like I'm jumping too far ahead, but there are intentions around this, more sharing data, more sharing practices, sharing of resources. And so that is coming, and just continue to stay connected with us.
Thank you.
Any more questions? Feel free to raise your hand or put it in the chat. We have plenty of time. All right. If those are all the questions we have for today, we can go ahead and start closing. If anything comes up for folks as I'm speaking, please don't hesitate to raise your hand or putting in the chat. I want to thank you all for coming today and joining the conversation. Give it up for yourselves for being here, and also give it up for our wonderful speakers, Marna and Alli, and also our amazing support in tech, Patty, also my supervisor, who was super helpful with putting all of this together. Throw an emoji up on your screen to share how you're feeling after this conversation. Feel free to write it in the chat. We also invite you to continue the conversation and stay connected by following us on all our social media accounts. Patty and I will go ahead and copy those handles in the chat. I'll also share our impact page from our website, which I also shared earlier on in the conversation, so that you can access a lot of the research and data that SisterWeb has out in the public. Thank you all so much.
Thank you, everybody. And I see you, Rudy. Yes, stay on the call. We have a former SisterWeb staff person. that we have to keep tabs on.
Hi, Rudy.
Thank you, everyone.
Thank you, everyone. I see.
Oh, Ashley, did you have a quick question as we're wrapping up?
Yes, I have put it in the chat. Ashley Skipper Thompson with the AIM Doula program, part of Los Angeles County. And we're interested in moving towards a database. And we did a compiled demo, but I was just wondering how was that with like, birth workers and the database and what that transition and support looked like.
Thank you so much. Your question is very timely because we are in the process of looking at becoming almost like a technical assistance or support to other doula programs looking to sign up with Compile. We've put a lot of sweat equity into figuring out troubleshooting some of those kinks of getting an entire staff onboarded into the platform and troubleshooting some of the things that have come up for doulas. So if you're interested in finding a time to chat offline about it, I put my email in the chat. I'm not sure if you saw it. I can put it again, but I would say, my quick answer to everybody on the call is that any platform, any tech platform is going to have bumps, right? So Compile, we've found that it is a great fit for SisterWeb. We really like how malleable, moldable it is. SisterWeb actually redoes its client forms every single year, which seems extreme, but we found that if doulas and the coordinators have a lot of say into what we're asking clients during visits and how we're documenting, it really keeps our forms relevant. It makes sure that we stay ethical. So if we're not using certain pieces of information, let's stop asking clients about it, right? And also if the information on the forms isn't gathering the pieces of data that our doulas need to do their job, let's add more questions on for the coming year. So it is a very time-consuming process to go through the editing and auditing every year. But I would say, as like my one nugget on this call, it is worth it. Definitely do it. And happy to talk more offline if you want to email me.
Yes, thank you so much.
Thank you, everybody.
Thank you.